Hi and welcome. It's Wednesday, and Wednesday I will be live here in the Facebook group in the Heal from Tired to Energetic. And here is where I will address topics that you are interested about, things that will help you on your health journey, on your recovery journey, from tired to more energetic. So if you have any questions, if you would like me to talk about certain things, please let me know, post it below or send me a message, because this is something that's super important to me, that I bring value to you and actually answer the things you are wondering about and you would like to have more information on. So today we're doing something a little bit different, has nothing to do with energy and how to get more energy, not directly at least. Today is something special, and I've been waiting a while to talk about this, but I've been holding off. But I feel it's long overdue that we have a different conversation around COVID and around vaccines and the nutrition piece actually in this equation. So this is not supposed to be a bashing video where, like I'm just expressing certain opinions, because I know we all have our opinions about what's going on right now. So this is not my intention. My intention is really to inform about the nutritional side of the virus and vaccine, and what we might not know because mainstream media does not really inform us about it. So we already know a lot of things about nutrition in the context of influenza, of vaccines of influenza, but also the virus itself. But there weren't many studies done on COVID, obviously, initially, because we didn't know that virus. So I've been waiting to do this live until we actually have studies that were specifically done with the COVID virus and nutrition. So nutrients, nutritional support, anything that could help us either in not getting sick as fast, recovering faster, or even treatment. Okay, so this is something that I've been waiting for and looking into for the past little while. And so the first studies that came out were, I think, this past summer, I think June or so, something that I saw was the earliest. And so I want to relay this message to you. And again, it's not so much about opinion, it's more about facts and things that I feel is important for all of us to know. And so let's start going backwards. We start actually with the vaccines, because that's right now the big topic, obviously. We're all waiting to get vaccinated so that we can return to normalcy, right? That's the big message that gets relayed in the news and media, and that's like top of mind everywhere you look, everywhere you scroll. Every news channel is all about the vaccines and when and how many people get vaccinated. And of course, we think, or like we hope, that it will give us the best protection if we're all vaccinated, and it will give us the protection that we need in order to live a normal life again and resume all the activities that we were doing before the pandemic. But whether a vaccine, and that's not just for COVID, but whether a vaccine gives us maximum protection, like what we want, depends on our nutritional status in our body. That is super important to understand and to know that it is directly related to how nutritional sound we live, right? And so let's explore this a little bit further. And I do have my notes here because I don't want to forget anything important. So we already know right from the get-go, and we saw that happening, that people who were obese or had underlying health conditions, they were more prone to get seriously ill with COVID. So that was clear pretty quick after the pandemic started, and they were at greater risk of dying. But that's also because we had studies on obesity and underlying conditions and the immune status, right? But also now going back to the vaccines, they have now also found that the vaccine for COVID, those with obesity might find them to be less effective. So there are studies now that actually have shown that people whose immune system is adversely affected by obesity may ultimately lack vaccine-induced immunity. So that basically means we hope we have maximum protection, but it might not be the case, okay? This is just a piece for you to know. And going back to nutrition, it has all to do with nutrition, how well you respond to the vaccines in the end, right? So if we are prone to diseases that get aggravated or induced by obesity, then that will also give us an indication how well we will manage with a vaccine. So there you see again, we can't really take nutrition out of the discussion in any way. We can't take it out on the infection itself, but we also can't take nutrition out of the vaccine debate. And I don't know about you, but I have never heard this piece of information in the mainstream news and media. And I think that is just sad, because it could help people really take action and improve their health, improve their life, and it will take away a lot of anxiety as well, right? Wouldn't you agree with that? Like, I totally think that this is worth a discussion on a broader level than just us practitioners relaying this information within our groups. So going back to the virus, we already had substantial evidence on which nutrients would work very well on viruses like influenza. And at the beginning of the pandemic, I was offering an immune support program, still available by the way, where we would use all these nutrients we already knew about to support our immune system. And I was waiting for studies on exactly those nutrients in terms of COVID to see if they also prove to be as effective as we already know for influenza. And turns out they were. Okay, so it was actually, if we have taken action right at the beginning on the pandemic to strengthen our immune system, we would have already won the lottery here, because we can apply all of this. And I will go through them in a second. But just go back to the nutritional status. I found a study that came out in Germany, and it was in German. So I thought it was really interesting that, you know, the older population, the ones that were more at risk to get the COVID infection and be more seriously ill, they found that they are severely nutrient deficient. So actually up to 83% of this age group, 80 and older, were nutrient deficient, is what the study found. And the nutrient level in the body determines the state of your immune system, right? So it's directly linked. And so that shows that our immune system suffers if we're not nutritionally sound. And so the older population is deficient in nutrients, and so we've just created the perfect host for an opportunistic virus and its consequences. You have a weak immune system, you get attacked harder. You are obese, have underlying health conditions, you get attacked harder. So there's no surprise. This is not new, right? But it's not really been relayed as there's actually something we can do about to not be as affected as maybe we were now globally, right? About all these things you hear on the news constantly, who's infected and how many people die and all of this. We don't want to hear all of this on a regular basis. It's not good for us, for our anxiety, but it's important that we really understand what's happening here. So let's go through the nutrients that the immune support program was including, and that also show now that it helps with COVID. So we talk about vitamin D, we talk about vitamin A, and then I mean the retinol, not the beta carotene. We talk about vitamin C in combination with quercetin, but even just plain vitamin C. We talk about selenium and zinc and omega-3s as well. So, and combined with an adequate protein intake, because here's a very interesting piece of information. Protein is very, very important for a strong immune system. And it turns out that the protein status in older people often decline. So it declines with age due to, we get more sedentary, we don't work out as much, we don't eat as much, and so we lose muscle mass often. But actually an older adult needs as much protein as an athlete to maintain the muscle mass and the immune status that we need. So this is something that I guess most of us are not aware of, that we actually need more protein than we think we do. So let's talk about vitamin D. It was interesting to see that in the summer months, the rate of COVID infections went down, right? In the summer, we thought, okay, it's getting better, we're getting safer. So sunshine and heat is something that the virus doesn't seem to like particularly. And also vitamin D in the summer, the levels that we're exposed to are usually higher. So is that a coincidence or not? Well, we can speculate about this. But the vitamin D status worldwide, actually, or at least in the European and the North American realm, is that most of us are vitamin D deficient. And that is just a fact that we're not really consuming enough vitamin D in our diet if we don't supplement to have an adequate level. And also, when we get older, we lose the ability to absorb vitamin D from the sunlight, and it can decrease by up to 80%. So if we started out with a low vitamin D status, and then it decreases as we get older, you can imagine what deficiency we create. And if an older person does not supplement with vitamin D, it basically is like you're inviting, the opportunistic virus into your body, saying, well, here, I'm not having any defense system, come pick me, right? So we do really need to talk about vitamin D supplementation, and we can no longer ignore it for almost anybody in this population in North America and Europe. Because we also know that vitamin D deficiency increase the morbidity in all immune system relevant diseases. So everything that's chronic, if we're talking about cancer, if we talk about heart disease, if you have poor vitamin D statuses, you are really more likely to die faster of these conditions as if you had adequate levels. So vitamin D, super important. And so data has shown, there's preliminary data, that the higher the vitamin D status in an individual is, the lesser is the infection rate with COVID. So I thought that was really interesting too. So if you have really good vitamin D levels, you might not even get infected with vitamin D. The virus doesn't have much to hold on to in your body, and you will be one of those maybe who are asymptomatic and don't even know that they have anything. So moving on to vitamin A. So vitamin A, the retinol version, works synergistically with the vitamin D in the body on a cellular level. So they both are needed for the immune system to work together and do their work together. And also, studies have shown that vaccines in general respond better when they're complemented at the same time with vitamin D and vitamin A, the retinol, in combination. So here's something that should, be taken into consideration at the doctor's office, that asking people about vitamin D or vitamin A, or checking them or giving them supplementation when vaccinating them can actually be really helpful, again, in the vaccine efficacy. And also, most people are believed to be deficient in vitamin A naturally already due to a genetic mutation. They have done studies in Europe that saying that up to 75 people of the population in the industrial world do not have adequate vitamin A levels and also don't have it through nutrition, right? So that is something that we need to look into a little bit more. If not, maybe on a broader scheme, vitamin A could be a good supplement for us. Vitamin A is super important for the integrity of our mucosal linings. Those are all the membranes and everything that protects, for example, our respiratory tract, our digestive tract, our urinary tract. So this lining relies heavily on vitamin A. And it's also an immune modulator. It regulates the immune system and supports it in the area where it needs to be supported. So vitamin A is super, super important. Vitamin C, we probably have heard all of vitamin C already in the context of COVID. It's already been used, vitamin C therapy, excuse me. Vitamin C therapy is being used in China already as a complementary treatment of COVID patients, so high doses of vitamin C. So they have already seen benefits there when treating the people, because it's supporting the respiratory function, so it strengthens the ability and ultimately decrease the need for people for ventilation. So it has been proven to be a very, very good complementary strategy, but also preventative. It is a very good idea to just get our defenses up. And luckily for vitamin C, that's the easiest vitamin for us to get. If we eat a healthy diet of fruit and vegetables, we can pretty much cover our vitamin C needs on a daily basis. So that is really the easiest thing to do for us. And you can implement that right away, and you might not even need to supplement additionally. Moving on to selenium. Selenium is not as much in our food anymore than it should be and than it was in the past. That's due to our common farming practices. We have overused and undernourished soils these days, and they lose their mineral content. And among them is the selenium status, and there is a study coming out of Zurich that is warning that we are not getting enough selenium in our food. And worldwide, by the way, it's not just here, it's everywhere. And if you follow me for a while, you know that selenium is super important for thyroid function. Everyone who has a thyroid condition is recommended to supplement with selenium and eat Brazil nuts. So these two in combination would be awesome. But it is also very much needed for the immune system. And there was a study that I thought was really interesting. It said that COVID-19 cases directly correlated with an insufficient selenium status. That's a new study that's coming out of Berlin and showing that actually selenium status does matter in how sick you can get with COVID and if you get sick at all. So if you have a thyroid condition, you might already take selenium, but if you don't, might be a good idea to get the status checked, and that can be checked with your doctor. You can do a test to see where you are. But just bear in mind, selenium is super important. So the last mineral I want to talk to you today about is zinc. And you might have heard that in terms of influenza prevention, or when you have a cold, that you take zinc lozenges to recover faster. And that's because zinc is important for enzymatic activities in the body, and we believe that it's up to 3,000 different activities that zinc plays a role in. So the body needs a lot of zinc, right? That's the bottom line here. And when we think about the thymus, so the thymus is a gland here in sort of like in this area, and that's where immune cells get produced. So the thymus gland produces our immune cells with the help of zinc. Okay, so it needs zinc to do that. But also as we age, the thymus gland decreases, like it shrinks, and also it needs to produce more immune cells, but it gets, of course, a little bit lazy because it doesn't have the function anymore than it has as in younger years. So we need more zinc, right, to keep up good immune function as we age. So that's a mineral where it actually increases how much we need the older we get. And also zinc has antiviral properties, which we want to have here, right? Antiviral properties. And it has shown that it blocks the AC2 docking cells. That's where the virus docks onto to get into the cells. It's blocking those. So that's a good thing. That's what we want, because if the virus can't get in the cells, then it can't replicate, okay? So that zinc is super, super important. So now let's talk about zinc in foods, because if you are a lover of oysters and kidneys and liver and heart and brain, then you're probably fine. But truth be told, most of us don't really eat these types of meats anymore on a regular basis. And a lot of us who don't eat meat at all get zinc from plant foods, right? So zinc can be in nuts and seeds, for example. That's where we would find zinc in plant foods. But if we eat conventionally grown plant foods, it's meaning not organic, and those foods contain some sort of pesticides residues on the produce, then the zinc molecules bind to those molecules of the pesticides, and we don't absorb them as well. So even if there's zinc in plant food, we might not absorb it as well because it's bound to those residues of pesticides. So just bear that in mind. Even if you think you eat a lot of foods containing zinc, it might still be worthwhile supplementing here, especially now in these times, to support our immune system. So let me just wrap this up by saying nutrition and supplements, in my opinion, are a cheaper way to deal with this pandemic than what we're currently doing. And having adequate nutrient status would be so helpful in the prevention of COVID, but also now it shows in the treatment of people who are affected. It should be used more in hospitals, complementary to the current treatment strategies. So I find this topic super important, that we know about it, that we talk about it, and that we really have a general effort for all of us to become healthier in every aspect of our lives. But nutrition is really, it makes or breaks everything that's going on. You know, maybe not all of these people that got sick would have gotten so sick if the nutritional status would have been better. I mean, of course, that's generalizing, but I think it is really important that we have this conversation and we look at all aspects that there are, and not just one single approach and one single formula. That is usually never a good idea if we just look at one thing. So this was super important for me today to bring to you. Nutrition is everything, in everything we do, in everything we are, and in everything we want to be. All right. So I hope this was helpful for you and you enjoyed it. You can read the blog post and you'll find more details there on my webpage, and I'll post the link in the comments below. So I've written about it so you can read it again. Feel free to share it with someone who might be interested to read more. If you have any questions on this topic, please let me know. I'm here to help, as I said before, and I'm looking forward to talking to you again next Wednesday. Have a great week, everyone.